Shut the Front Door, a podcast from Infinity Hydration and Wellness. Join us for holistic health and wellness talk designed to help you feel better emotionally, mentally, and physically. Time to dive in.
Welcome back to Shut the Front Door. Tonight, we're talking about you feeling like crap and occasionally getting dismissed. Going to your doctor, getting your lab work done. So your lab work looks perfectly fine, but you still feel awful. Is it all in your head? I don't know. Corinne, you were going down the rabbit hole of what happened to you.
Oh, with my medications?
Mm-hmm.
We were just talking about without ever doing lab work or anything, like checking my vitamin D levels or like my B12 to see if it was my energy. They were just like, here's an SSRI. Oh, and you're 16 and we're also going to put you on Seroquel because we think you're bipolar, even though it's probably your hormones.
You were 16?
Yeah. 16.
I didn't realize that.
They put me on Celexa, they put me on Ativan and Seroquel. And then when I got pregnant later down the road, like I was still taking the Seroquel and it's addictive, and I like withdrew hard off of it, like night sweats, heard voices, like felt like garbage. Turns out I have ADHD and other things, and I'm not bipolar.
Oh my gosh.
Yeah.
How many years were you on that?
I think I was like 16 until 20.
Wow. That's awful.
Yeah, and I think sometimes we decipher and we think normal labs mean maybe we have imaginary symptoms, so we get in our own head thinking, are our symptoms actually real?
Are we just crazy?
Yeah, but I mean, we found this out by using multiple lab companies here that everybody's ranges are so different. And then a couple years ago, we found out that it is a population average or your normal lab values, not necessarily what is normal and optimal.
Yeah, so whenever I talk to clients, I'm always like, I'm going to encourage you to change your language from normal to average. You are average when you look at all your normal ranges. That doesn't mean you're normal for you and your symptoms. And I told you about this, but I didn't tell you. Did you ever see that meme online where the doctor with the white coat is standing with a clipboard above a casket?
No.
And and he's talking to his patient and he's like, I don't know what's going on. I don't know what's wrong. Your labs are normal. It's the perfect depiction because you can literally be dead and they will still say, well, your labs are normal. I can't.
Well, you've gone to how many referrals and bounced around?
Even with just like cardiology. And the last one that I saw, he's just like, oh yeah, everything's normal, but I don't know why your heart rate's high. Here's some Cortizem. I don't need to see you back. Just take it and message me if you have any problems. I'm like, at that point I was like, I think 30, and I'm like, I'm not taking Cortizem right now, and then not even going back. But he's like, yeah, you're normal. Nope, not normal. Turns out after I went to Hershey and had testing, I have POTS. I don't need Cortizem.
So don't you think, especially with young girls, all these autonomic nervous system disorders, and you go from POTS to, I can never pronounce the one with the D, dysautonomia. Do I say that right?
Yeah.
And then you go to mast cell activation and Ehlers-Danlos. And all these things that are happening to the young girls, I don't even want to know why. I mean, who knows? We could hypothesize on that all day. But do you think, looking back, if you would had knowledge of all of that, like how would things have turned out differently, do you think?
I wouldn't have been on so many different medications. Like I was 19 and I was on probably 10 or 11 different meds until I realized like I was having all the side effects from them. And like, it wasn't until I got pregnant and I had to get off all of them. And then I realized, oh my gosh, I feel a little bit better. But I was just bouncing around from different specialists to another specialist, like my stomach specialist, and they took my gallbladder, which looking back, I probably could have kept my gallbladder. Like, I probably didn't need the surgery and all the problems that I had after having the gallbladder removed. It was probably part of the Ehlers-Danlos things going on.
Are you guys going to do a whole podcast? Sorry, that was probably loud. Are you going to do like a whole podcast on?
After we get our labs.
So did you know
EDS?
Corinne and I sent out our labs today
No.
on EDS, and it
genetic testing.
20 markers.
Mm-hmm.
And I said it'd be really cool to find a specialist who would come on the podcast and explain our labs to us then and what that all looks like for us. But I mean, really listening to Corinne, and then maybe I've just been in denial for so many years of saying, no, I don't have that. And then finally my chiropractor even saying, have you ever been tested for EDS by any chance? Because my hip wouldn't stay in.
Yeah.
And the scoliosis and the dental issues forever, my thyroid disease, like all the things coming together of, is that what's wrong?
Well,
and then how much our symptoms are like the same sometimes.
Mm-hmm. And Lindsay today asked me, she's like, so will you feel more at ease? Like, why are you even doing the labs? And I was like, I'm pretty sure that I have it. And I just want to do it because I feel like more people have it and are just being gaslighted and not listened to, or they're just saying, oh, it's your anxiety. Like, you're just crazy. And then you really question yourself. But I just want to know just so that I can help more people. And I don't know. It's
I just sometimes we gaslight ourselves.
yeah.
And I really believe that sometimes we ourselves, even as healthcare professionals, need to be validated that we aren't crazy. We're a little bit crazy, but we're a little bit crazy. But all these symptoms we're having, even though we trudge through it every day, it's mind over matter all the time. We do all of the things even though we feel like complete crap most days. We still wake up, we still come in, we still care for however many people we see in a day. Today ended up, I feel like, being way overwhelming. But then to see it on paper of, oh my gosh, like I do have something wrong with me, and no, I'm not crazy. It just validates that we don't have to gaslight ourselves all the time. And that just seems to be so common within the whole population.
Well, because there's another end to that spectrum, right? You have all these wussy pants running around crying about every little thing. So, and I'm sorry, but sometimes I'm just like, okay, you have a hangnail, put a Band-Aid on and move on. But
I was just going to say, I had a friend message me before and was like, can you look at this hangnail dry? I got to go to the ER. And I'm like, do you have a fever? Is there a red streak up your arm? Is there even pus coming out? Like, no.
So we have to kind of find, and so I always try to see both sides of every situation, and I can see how a lot of physicians have become jaded, and they're like, oh, here we go again, another hypochondriac, But on the flip side of that, and it especially happens to young girls, like at your age, that they are being handed anti-anxiety, depression meds, all these things, when if you would just believe them and just spend a little bit of time with them and their family, talking to them in the office, you can pretty much, if you're an intelligent person, pick up fairly quickly on if this person is like snowballing you or not. I mean, you can look at their history and get to know them. And hey, if they're like 16-year-old girl, right? What do you do in school? What are your grades like? What do you like to do with your friends? What's your extracurricular activities? And if they're pretty active, they're probably not a hypochondriac. I'm guessing that they want to be in their life. So the fact that happened to you, I have another question for you. So when you were on those drugs until you got pregnant, were you feeling better at all?
No, because I'd have to meet with them. I don't know. I think it was like every 30 days to check with your meds. And they switched me from like Celexa then to they upped the Ativan, then they switched from the Ativan to the Klonopins to the point where I wasn't even like functioning or remembering stuff and sleeping through my alarm for college, not waking up for classes. Then they switched me to like Zoloft. Like they were just bouncing because I wasn't feeling better. It wasn't working. And they'd up my Seroquel. I think I started like 25 milligrams and I went to 50 milligrams, like all in conjunction together. And I was just like a walking zombie.
Oh my gosh. I'm so sorry. That's awful to do to a young person. Yeah. It sucks as an adult, but can you imagine as a young girl? And I've been there, done that with my daughter. It's all in your head. And they were willing to let her die at 70 pounds when she was 17. 70 pounds. Well, it's all in your head. You have an eating disorder. And her dad got mad. I'll never forget him saying, even if that was true, which we kind of wished it was true because it would have been easier to handle, to a certain degree. But even if that was true and she would have had an eating disorder, they still sent her out of the office with an SSRI and was like, it's all in your head. You didn't even refer us to an eating disorder clinic. You didn't even do your job there. So it's like, but it ended up being everything that you have. So genetically speaking, when you guys said you sent your test out, how do you feel about, let's say it does come back. Well, we know you have it, right? And you probably have it and I probably have it. But what if it comes back as that? We all know that there are certain things that like you guys can do here at Infinity that helps it, but there's no quote unquote cure. Being armed with that knowledge, how is that going to make your journey a little bit easier moving forward?
It kind of goes with like what Lindsay asked me, like, what are you going to do with it? And I'm like, my treatment plan for myself, obviously, once I'm done breastfeeding, isn't going to change. I'm probably going to just hit ozone hard, keep my vitamin D levels up, do my monthly infusions, like the things I'm already doing. But it just makes me feel like I'm not crazy. And then I just feel like I'll be able to point other people in the right direction and help them. Like that's my biggest thing. And then with like my daughter with her breathing stuff, and I want to go back and see what they tested compared to my test, like if stuff comes back positive, and see if maybe that's linked to her breathing issues that we get gaslighted for all the time.
I think it's important to roll things out too. Yeah. I mean, if it's not this, like we know our symptoms are not in our head and we actually have them.
So it's not just validation, it's stay the course with the treatments you're doing. And it's just fascinating with the whole epigenetics treatment. And then also something else you might have thought of, maybe EDS at its source is a connective tissue disorder, right? So to have it on file with your, like in the system, right, at all the hospitals and your doctors is super important. We found out when Gabriella had her colon removed, it requires a special extra time and special stitching because it's trying to sew together after a surgery. If you have a connective tissue disorder, is like trying to sew gum.
Oh, I've had wounds dehiss.
What does that mean?
Like
breaks open
because it can't stay shut.
You probably do have it then.
Yeah. Like that has happened to me a couple times.
So for that factor alone, can you imagine if you ever needed surgery or emergency surgery and that was not in your file?
That's what I said. I'm like, God forbid. I know I probably have it, but God forbid it's not medically documented and I have some emergency and they don't know how to handle it. And I mean, they might still not know how to handle it because I think they learn about it, but like it's just bringing more knowledge to the other doctors in Western medicine.
Absolutely. Yeah.
And not only that, we're so fortunate to be here. And okay, so you have it. Now let's come up with a game plan. Let's put a program together. Let's help a whole group of individuals that's not getting any help. They're not being validated. Their feelings aren't being validated. They're being told they're anxious and crazy. They're being sent to psych nonstop, getting put on all the regimen that you were. So I'm sure we have a bunch of walking zombies that truthfully have a major chronic illness.
And not just EDS, but do you know how many clients I've seen this week? A lot more than normal for some reason that were told that they were just handed out SSRIs like candy. And then we do the labs and we look at them at a foundational level. Oh, that's right. I'm sorry. What if we fix your ferritin and your vitamin D and your thyroid and even amino acids and minerals and all the foundations of that make up who we are, at a cellular level. Oh my gosh, I'm not as anxious. I can sleep better. I'm not as irritable. I'm not as depressed. And all I did was fill in the blank. I'm like, yeah, that's how medicine was practiced years ago. 1930s, 1940s, 1950s. That's how it was practiced. They looked at those foundational, what are you missing on a vitamin, hormone, level, and they just don't look at it anymore. You go in, I feel this way. Okay, yeah, here you go.
Try this.
Here's a script. Here's a script. Here's a script.
And how many of us probably have like MTHFR mutation?
Oh yeah, they say what, 50% of the population? Well, I know I do. My girls do. Yeah. And so, what's that book by Dr. Ben Lynch, is it? The 7 Dirty Genes? I don't remember if that's his last name. That was super interesting. MTHFR was one of them. And it's not and I think you're the one that taught me this. It's not a factor of, the gene mutation that you have. We all can have it, right? In a population, it's what genetically is going to turn it on and turn it off, right? Like some people it gets turned on, other people it doesn't. So, you might just be an unfortunate one for whatever reason because of toxins or whatever, right? That gets turned on.
Trauma, car accidents, that turns a lot of them on.
Growing up in an Italian household.
Yeah. So adverse childhood events.
That could turn on all the dirty genes. I had to throw something weird in there.
Help.
But no, it's true because I think, what's exciting? People are learning. They're coming to me going, I know what to look for now. Like I'm getting educated through places like Infinity and I'm trying to learn stuff on my own. And I realize that just because my sister and we share parents, it doesn't make us the same person. So just because I might have had a gene turned on doesn't mean she's going to, or she's dealing with something doesn't mean I'm going to. And everybody, has different symptoms and could mean different things. And I just feel like people are getting more educated and they're being their own advocates more so than I've ever seen.
Yeah.
And that's
and
exciting.
chronic illness doesn't always show up on their lab work either. And how often being dismissed, they're learning the steps of, okay, I'm going to track my symptoms. You said it best the other week. Somebody was going through and trying to figure out gluten and dairy intolerances. And you're like, okay, track what you're eating, bring it back to me. Let's figure it out together. Rolling things out constantly because nobody's ever going to have all the answers. Look how much we're learning.
I know.
Literally daily and how much stuff is changing.
I know. And it's not just tracking what you're eating, it's tracking how you feel and other things too. Like I told that patient, okay, don't just write down what you eat. How did you feel after you ate it? Did you go into a gluten coma and want to sleep for 2 hours? Did you get diarrhea? Did you throw up? Did you get a stomach ache? Did you get constipated? Track how you're feeling and what's happening to you. Could you not fall asleep as well that night? Because your body talks to you every minute of every day. Listen to your body. And it's just so important. Everybody is so different. It's important to learn what's best for you.
No, if our bodies could only talk out loud all the time.
Moving on.
Like how you felt all the time.
Yeah.
We pretend we don't feel not that we pretend, but you and I talk about this a lot, that we push through everything.
We have to gaslight ourselves. Our worlds would fall apart if we didn't. Do you know how many people depend on us? Hello, you're a mom. Yeah. We can't. I remember when my Hashimoto's was at the height of its like over 3,000, right? Antibodies. And my girls were little. I owned my own business. And I just remember feeling like I was literally dying. I'm like, I must have cancer. I have to have cancer. But I still laid in bed and tried to read them a bedtime story every night. And they were like, Mommy, are you drunk? And it's like, no, I think I'm dying, but I'll read you the story. And then they grow up. Our kids just grow up and then they're on the couch complaining about us in some therapist's office. Do they realize what we were doing? It's always the mom's fault. Okay. I have 2 daughters, so I just sit back and go, okay, see me when you're about 35 and you're in the thick of it. Because I'm going to be sitting my butt on a beach somewhere, sipping my tequila, laughing at you.
Oh boy.
But the mother, in all seriousness, when you are a mother with chronic illness, can you imagine? Well, she doesn't have to imagine, but it's awful. It's awful. So, getting back to the lab work though, we totally went off on a whole tangent there, but getting back to the lab work. So if you get your lab work done and your regular Western medical doctor, PCP, whomever says you're normal, you're in normal range. I urge you to say, no, I'm not. Doctor, I'm an average, and then come see us at Infinity, and because you have to work with the symptoms too, right? So with hormones, I have several women that their testosterone was okay, it was kind of around the middle somewhere, and they're like, but I have no motivation, I don't want to leave my house, like even to go to the grocery store, I have no libido, like all the testosterone stuff is off. And it's like, okay, then the doctor says, let's just try a little bit, like very conservative amount of transdermal cream. And then their whole world changes. That is the perfect example of listening to the patient, treating for symptoms, still being very responsible about it, and then helping them live just a better life,
When we were talking about hormones earlier in one of the patients, and like one of them were just like kind of a hair on the lower side. And Jason was like, I typically like am not like too crazy about it. He's like, but I wonder how she feels. And I'm like, bingo, baby. Like, yeah. How does she feel?
Right.
I don't know. And then we have the other end of it when we have some ladies who are like, I don't want testosterone just yet because I'm going to want to have a lot of sex with my husband and until he gets on some, then we'll talk about it. And then we all have a conversation and it's happening. I'm like, oh, okay.
Yeah.
Everybody's having sex.
Yeah. We are saving marriages. We are though. But it is funny because a lot of the patients, they will say like, well, wait, I got to bring my husband in because like we better do this at the same time. I'm going to have a problem.
What do I do with myself?
I'm going to have a problem on my hands. Why do we always come here?
There's a lot of babies popping up lately.
Oh my gosh.
I know. I asked the one of them, I'm like, you guys like fix? Like,
yeah. Oh my gosh. It always turns to sex.
When I talk about sex, me.
I mean, their labs were kind of normal, but they didn't have a sex drive.
Yeah.
Men with their testosterone levels, they're normal. They're within the normal range.
But they're still saying, I'm low on energy. I can't work out like I used to. I can't build muscle. My libido's low, whatever. Then it's not normal for you. It's not normal for you. And I feel like the standards, whomever they are, they keep lowering the standards for testosterone for men. Bring back real men, please. God. Just give them some testosterone. Please, for the love of God.
Jason and I had that conversation today, too. He was like, oh, I'd love to give more men testosterone because we need more men.
I'm sorry, but look at some films. Look at some films in the 40s and 50s and look at today. I'm sorry. Something's going on. Okay.
sorry to the guys that
as we have men.
The behind the scenes men right now are looking at us like
they're over there like going, oh my God, I hope my biceps are big tonight because she's looking at me. They're over there doing push-ups.
Yeah, they're ready to fight.
Okay, so now we got to rag on women since we gave men a hard time. So bring back real women too, for the love of God. Everybody's hormones are messed up. And I just feel like as much as masculinity is going out the window, so has being feminine. And it's like, it's not a bad thing to be a woman. Just embrace it. And, so that's my 2 cents on that.
Back to the cascade of symptoms, since we got way off.
Yeah, we are. Yeah.
A patient came in yesterday and they were talking about why do people put on Facebook how they're feeling all the time and going on and on and on about all of their symptoms. I don't know. I kind of struggle with that answer. On one hand, I'm like, do they got problems? On the other hand,
what do you mean? Do they have mental problems?
Wow. You're an SSRI.
I wasn't going to say mental problems, but are people just looking for someone to listen to? What is the purpose of putting everything on social media with like every step of how you're feeling?
I feel very strongly about this, so she better go.
Are they looking for somebody to point them in the right direction because they don't know how to help themselves?
I wonder that. I try to look at both sides. Are they looking for help because they aren't getting it at their PCP's office? Because I just found out that one of the PCPs around here only takes a time slot of 5 minutes per patient.
I believe that.
What?
Yeah. And I was like, how do you
God, that makes me sad.
How do you have a primary care visit in 5 minutes? So are they going to somebody like that who's not listening to anything, or go with your strong feeling? Because this is probably the other side of my brain.
It's both. I think it's both. I think you have 50% that are so weary and so desperate for help that they're just looking for anybody to throw out answers to them. And then the other side is the wussy bucket that I talked about earlier, where it's like, for the love of God, stop talking about your personal crap on social media. And I don't know, like, go talk to your spouse and go for a walk, go work out, cook a meal. I don't know. Do something that, is old school. Get a puppy. Do some volunteer work, So
we need help here some days.
Yeah, there's definitely 50-50. And then, not to take this down another, I know I always go off on tangents, but something just popped in my brain. This is, in all seriousness, a big issue. I feel like a lot of spouses, both female and male, but mainly female, mainly the wives, but a lot of spouses feel ignored in their marriages. And I feel like
females feel ignored or males feel ignored?
Yeah, they both go through it, but I would say it's like 75-25. It's like 75% of females feel ignored in their marriage. And there are some men too, but I have seen a lot of women that take to Facebook that initially you want to be funny and be like, oh my gosh, tell her to shut up. But in all seriousness, she's so desperate for somebody to pay attention to her. And then that starts a whole other opens up Pandora's box for all other issues. But I just feel bad because I think so many people are suffering and there's nobody listening to them, whether it be their spouse, their physician, their friends. And then if you're suffering for a long time, and I don't know if you can speak to this at all, but if you have a chronic illness and it's years and years and years, you start to lose friends. And a lot of people lose their marriages because they don't know how to help and they're frustrated and they just want to live a normal life, and people drop off like flies. Have you found that?
Yeah. I mean,
yeah, even family members are like, you can't even turn to them anymore.
Mm-hmm.
It makes me sad.
Like you're just making it up.
Yeah. And of course, I'm always speaking about Gabriella because that's what I see with my daughter. And it makes me so sad how isolated people can become. That's why I think they're going to social media and saying everything, too. I think it's one of the reasons.
Yeah, there's definitely both ends of the chronic illness world. The ones who talk about everything about it, and then the ones who don't say anything and suffer in silence.
Yeah, like, at least for Gabriella, she's always saying, like, I don't want a t-shirt. I don't want hashtag chronic illness. I'm not a chronic illness warrior. I want to be hashtag I'm a normal person. So she's kind of like on the opposite end where she's so sick of talking about it. She doesn't want to identify with it. She's like, I don't want a t-shirt. I just want to be normal. And I just think these people are suffering. So they go on there and list out their symptoms, hoping that either somebody will have a suggestion for them or they're getting attention. They're getting empathy and sympathy that they're not getting from their personal life.
Yeah, or their doctors, or literally everybody is certainly being dismissed. And then when we brought it up multiple times, was it today, yesterday? Well, all these days are a blur anymore, about the cancer rates. 1 in 2 women, 1 in 3 men, and like it's over the age of 40 get diagnosed with cancer.
Are you serious?
That was one of the
That's
statistics
insane.
that I had come across in one of my researches that I did. And then one of our patients was in here and she pointed to all of us. You must not have been in here.
I don't think I was.
She pointed to me, Lindsay Riley, and she's like, you 3. She's like, see the statistics? Like, I know somebody in here is going to have cancer if we look at the statistics.
Ooh.
And I was like, oh.
Oh, just tell her to put her voodoo doll away. Jeez. And you know.
And I'm like, but okay, look at our exposures, look at our diet, look at vaccinations, look at the whole entire picture. If you were to run every single lab in the world on every single one of us, something is coming up. There's something going to be in the red.
Right. But can you talk a little bit from a practitioner standpoint on how the lab results vary from different labs even?
Well, it is the average that's sent into that lab. So
just that lab
alone, it's the average that they get, and some of them change by month. So in that month alone, so what are we in January? So in December, they came up with an average, and their averages could be changing. And when I called one of the lab companies, I'm like, your range kind of like changed drastically. It was the vitamin D level.
I was going to say, we just met with vitamin D.
It was the vitamin D level. It was 30 to 100, and now it's 20 to 50.
Huh.
And I'm like, why did we lower the vitamin D level that we're saying 20 to 50 is normal, but we know evidence-based practice says if you keep your levels above 50, you're 85% less likely to have cancer. So something's not adding up here. So mind blown.
Yeah. And I don't know who made the rules of how labs come up with what is normal or average. So my question is, I wonder, and I'm just thinking out loud, I wonder how we as a medical community can at least initiate or start to create change or request change, that when labs do evaluate people, they have to say the words you just said. Okay, for every line item, every lab taken, or at least category, evidence-based practice shows that optimal ranges are fill in the blank. Why can't, I wonder at what level, is that a congressional thing? Like, where do you go
in every
to the
lab,
FDA? What do you?
Every lab company is different.
That's what I'm saying. What I'd like to see happen is these averages being abolished, like these normals being abolished, and that here are your numbers, and here's what evidence-based practice says is an optimal
this is what our
range.
textbook says. Like,
Yes.
nonetheless, it's
So
what we learn.
Well, I wonder where that ever came about, that they started taking just, here's the average of all the people that submitted this month.
So when you're sitting looking at your lab work, you might as well be sitting in the middle of Walmart looking at
just taking a survey.
Yeah.
Hey, you over there, what's your ferritin? What's your vitamin D? Let me just calculate the median. It's so stupid. My God. Every day I'm alive, I find out something more, like, just, it's such idiocracy, more stupid about the medical system.
And I came across that one because somebody's vitamin D was low 30s, but they were like, I'm right in the middle. And I'm like,
oh, in the middle of a pile of crap. In the middle.
They probably felt like crap too.
Yeah. So that's something in all my spare time, that I would like to look into. How can we start to create change that they have to evaluate these labs differently?
Not only, I think it goes, and I think that's why so many clinics like this are popping up, is because kibosh the labs. Yes, let's get a value, but how do you feel?
Right.
How do you feel?
But it would be nice to have, like, I know your range that you like for vitamin D. I know your range that you like for thyroid. It would be nice to at least have that as a marker to go off of and be around that than to totally be shooting in the dark and just go off of symptoms. Because again, you could have wussy bucket pants. That's like, I just feel like crap every day, and you dig into their lifestyle and you figure out why. There's always that end of it too. So it would be nice to have that data, solid data in front of you. What is an optimal range instead of just taking the average of everybody at that lab that month?
Yeah. This is a scary world.
I don't want to be compared to everybody else in America.
Oh, you are.
Have you looked around?
Look at this. Yeah, we're in trouble.
I know. I'm very concerned.
All right. So if you are feeling quite awful and you aren't getting answers, keep going somewhere else till you get answers. It doesn't stop. You can't go to one place. You get multiple opinions across the board, and then you do your own research. That is not on TikTok. That's not on Instagram. That is not all. Chat GPT is wrong. There were a few things that we came across, and I was like, that just doesn't sound right. And so it'll tell you stuff that isn't always real. So, get every opinion out there, because if you are feeling like complete crap, we hear you, we listen to you, and we truthfully believe that something could be wrong with you. I don't know what that might be, but there's always at least 1, 2, 3 people here that are always willing to listen to anybody during business hours. Is great.
Yes, please. Boundaries.
Yes, we have learned how to make boundaries. But thanks for listening to us talk on Shut the Front Door, and we'll see you next time.